Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom. Good afternoon, everyone. Today, I want to provide an update on COVID-19 cases in the province and speak a bit more about Alberta's rise in active case numbers. I am pleased to report that more than 8,500 Albertans have now recovered from COVID-19. However, we conducted over 8,200 new tests yesterday and identified 114 additional cases. Currently, 106 people are in hospital, 21 of whom are in intensive care. Sadly, 2 more Albertans have died. This leaves 2 more families grieving their loved ones, and my sympathies go out to them. My sympathies go out as well to those who are in hospital or ICU, and to the families who are watching their loved ones battle this illness. This is yet another reminder of how serious this virus can be. Our current acute care utilization is approaching the highest number of admissions on any single day that we have had, which was a peak of 113 overall hospital admissions on April 30th, and specific to ICU, 23 admissions on May 1st. This needs to be a wake-up call. I am very concerned by these numbers. Recently, our active cases have risen sharply. On July 9th, we had 590 active cases. Today, we have nearly 1,300. 2 weeks ago, we had 7 Albertans in the ICU. Now we have triple that number. This is also a reminder that severe outcomes are not limited to the elderly. 24 of those currently in hospital are under the age of 60, including 7 who are between the ages of 20 and 39. In addition, there is no zone spared from the increase. Even rural areas, such as central Alberta, which has not seen high case numbers so far, now has 33 cases in hospital, 7 of whom are in the ICU. We have seen a rise in cases across the province, and as such, precautions need to be taken in all parts of Alberta. I believe the recent increase in numbers is in part reflective of the fact that fatigue has set in. After several months of not catching the virus, it is easy to say that you feel fine, so why wash your hands? Why stay 2 meters apart in public? Why avoid sharing food at a barbecue? While it is true that younger people who catch COVID-19 have a lower risk of severe outcomes, lower risk does not mean zero risk. In addition, we are all still at risk of catching the infection and passing the virus to others. To illustrate this point, let me give you some real-life Alberta data on the risks that do exist. In this province, 1 out of every 50 diagnosed cases between the ages of 30 and 39 has needed to be admitted to hospital. Between ages of 40 and 69, that risk is greater. 1 out of every 20 diagnosed cases has required hospitalization. And when we talk about older Albertans being more at risk, what exactly does this mean? 1 out of every 10 diagnosed cases between the ages of 70 and 79 has died. For those over 80, the numbers are even worse. 1 of every 4 cases has died. The risk of death does not seem to be much different when comparing those living in continuing care versus those in the community. Think about those you know who are over the age of 70 or 80. In my life, I have many dearly loved family members and friends in this age group, and I would not want to gamble their lives with these odds. It is also important to remember that surviving this virus can still be awful and life-changing. There is some emerging evidence of the long-term outcomes of COVID-19, particularly for those who have more severe illness, such as an ICU admission. There can be long-term damage, such as higher risk of diabetes, and lung damage that doesn't go away when the infection ends. Regardless of age, we don't yet know what impact COVID-19 will have on your lifelong health. This is not something to take lightly. The guidance we have put in place is the manual for how to live with COVID-19 for at least the rest of this year and likely beyond. It is not an optional suggestion that can be disregarded when inconvenient. To those who are wondering if it might be better to just accelerate the spread of infection across the population to get it over with and achieve herd immunity, it is important to remember that we don't yet know if getting infected actually gives a person immunity. Emerging research shows dropping antibody levels over time after infection. While we don't yet fully understand the implications of this, it is a cause for some concern that even widespread natural infection would not provide long-lasting herd immunity. It would, however, place a crushing load on our acute care system. It would also mean less system capacity for dealing with all the other health concerns that Albertans have. Currently, research is underway worldwide to find a vaccine. Exciting progress is being made, but we cannot say whether a highly effective vaccine will be developed in a few months, or years, or even ever. Even if there is one, there is no way to know how quickly we will be able to vaccinate Albertans. The message is clear. We need to learn from our own experiences and the experiences of others. We need to take current numbers as a warning and do what we need to do to prevent infections from spreading widely and quickly. We are all tired of COVID-19, but this virus doesn't care. We have no choice but to learn how to live with it. This means learning how to reduce risk while conducting a barbecue or visiting with our cohort. It means we need to minimize the risk of contracting the virus and the risk of spreading it to others. It also means protecting those most at risk while not isolating them to the point of suffering. The updated guidance for safe visiting in licensed supportive living, long-term care, and hospices becomes effective today. As you heard when I announced it last Thursday, the changes include the expectation that operators develop a safe visiting policy and process in collaboration with residents and families. While the operators have had a week to start that process, please be patient. There is a lot for them to consider and plan for, working with residents and families, and they may not have had enough time to finish getting input. But they are getting started and will continue to work with you as time goes on to mature and implement their plan. With the increase in cases we have seen over the past few weeks, it is particularly important that this safe visitor policy be thoughtfully and carefully implemented. Today I'm also announcing that we are posting a short video on our website that is directed to residents and their families. If you are someone who may visit or who lives at one of these sites, please take a look. The video will help you orient yourselves to the new approach to visiting and your role in helping to ensure a safe visit. This new policy will help people remain socially and emotionally connected while still protecting those most at risk of severe outcomes. It is critical that we continue to protect our seniors. They are at a high risk because of their age, and Albertans should be considerate and careful when interacting with our loved ones who are seniors by wearing masks, physically distancing, and staying away if sick. The evidence is evolving, but suggests that younger children may be less likely to transmit COVID-19. Despite this, some children who contract COVID-19 may not show symptoms, but could potentially transmit to their grandparents and older relatives if precautions are not taken. When schools open again, we have to closely monitor adult-to-adult transmission, which is likely a greater risk than transmission occurring amongst young children. At any rate, we must all protect seniors in our lives by keeping masked and 2 meters distant, whether we are symptomatic or not. For the sake of our families and communities, we all need to act each day as though everyone we spend time with could have the virus, even if we're among friends, and even if we feel perfectly healthy. That is one of the messages that I want to stress today. When you are feeling well, it is tempting to think that you don't need to be careful. Yet whether the case numbers go up or down in the weeks ahead will depend in large part on what precautions we take over the next 10 to 14 days and beyond. The numbers of new cases we are seeing today reflect trends in behavior 1 to 2 weeks ago. Even if we all implemented all public health guidance perfectly starting tomorrow, we will still likely have increased numbers for at least 1 to 2 more weeks. If we want to bring this under control by early August, now is the time to act. What will you do to stay healthy? How will you physically distance, wash your hands, and take all the other steps that will help keep you from contracting the virus or spreading it to others? The power is in our hands. No rule or order from me could change that. If you don't want to make these changes for yourself, I ask you to make them for others. Make the changes for the frontline healthcare workers who are dealing with increasing numbers of COVID cases in acute care. Make the changes for your loved ones who are at higher risk of severe outcomes. Make the changes for your kids who want to be able to go back to school in the fall. Simple steps save lives and can slow the spread. This weekend, I am encouraging everyone to go the extra mile. Wash your hands, physically distance, wear a mask when you can't, and if you're even slightly sick, stay home and get tested. I'm also encouraging Albertans to talk about COVID-19. Ask your friends what they are doing to stay safe. Ask each other about what's the hardest measure to follow, how often you wear a mask, and offer ideas and support to each other about how you can make measures easier to follow. Be the champion for safety among everyone who doesn't watch these updates. I know that people may have different opinions about how we should address the spread of the virus. Sometimes conversations can get heated when opinions are different, but I would encourage all of us to focus on listening to understand. If you are in conversations in the next few weeks, whether in person or online, with someone who has a different opinion, I would like to challenge you to listen to understand their perspective. If we share information with compassion and find ways forward together, we will all be better positioned to deal with COVID sustainably over the long haul. There has been a great deal of discussion around masks recently. It is something that I continue to discuss regularly with my counterparts in BC, Ontario, and across the country. I believe that masking is critically important, and we've undertaken many efforts to normalize and promote the wearing of masks over the last several months. This includes the government's distribution of more than 40 million masks across the province. We are looking at the evidence around mask use in school settings, and our guidance for schools will continue to evolve in the days ahead. As always, we are assessing the best and most reliable evidence available. There is still a lot of new evidence emerging on school settings, and there are reports from international sources that we are carefully reviewing. Also, let me be clear, I am strongly recommending that Albertans wear masks. As a physician and as a parent myself, I encourage all parents across Alberta to include reusable cloth masks on their back-to-school shopping lists this year. If you are watching this right now and don't wear a mask, please start today. Do it for yourself and for everyone around you. I want to end today by noting that we are a remarkable province. I believe in Albertans and the power of our collective action. We can pull together to turn this around. If you need motivation to distance, wear a mask, wash your hands, or stay home if you're sick, remember who you are protecting. We are each other's best defense, today, tomorrow, and in the weeks and months ahead. Thank you, and I'm happy to answer any questions you may have.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from James Keller of the Globe and Mail. Your line is open.
Hi, Dr. Hinshaw. You say that the increase seems to be related to fatigue and people presumably no longer following some of the public health advice. Is this a sign that the public health messaging isn't working, and is a new approach required, whether that's new messaging or some sort of policy response that might compel people to follow that advice?
We are looking at where there are perhaps more challenges with people following public health guidance, and we are looking at what options we have to try to directly remind operators, whether that's of businesses or other places that offer services or activities, to encourage operators to be following that guidance. And so I think you're right, there is a place for more local encouragement for that. I think that, unfortunately, given that what we're observing is that the guidance is not, not always being followed, putting perhaps new measures in place that may also not be followed wouldn't necessarily be helpful until we ensure that what we currently have in place is maximally effective. So again, I will say that not just individual Albertans in their own lives, but anyone who's responsible for an organization, for a business, for a public place where people gather, and of course those who are having activities perhaps in their own homes or planning a social gathering, really it is up to all of us to follow that guidance, and that is the only way we're going to be able to get our numbers down, is if we can get all of us pulling together.
Operator, can you put through the next question, please?
Our next question comes from Terry Reith of CBC. Your line is open.
Yes, hi. Thank you, Dr. Hinshaw. Good afternoon. As NHL teams begin arriving this weekend, what are some of the key metrics that you will be most closely watching? And once this is all underway, what can be done if things do go south?
With respect to the NHL teams arriving, we've had many conversations with both the Oilers group and have been in discussions with the NHL. There are guidance that they have developed for Stage 4, as well as additional guidance for professional sports tournaments that we developed. And so really the key metrics are going to be making sure that that guidance is followed, that we have the ability to ensure that there's the monitoring that those who are coming in are staying within that bubble zone, which is a key part of a success of this particular event. And so I think the metrics will be, again, watching to see if that guidance is being followed. We are having conversations with the NHL and the local Oilers group about how test results are going to be reported. And that, of course, is another metric to follow closely. And so ultimately, I believe that this can be a very safe event and a way of making sure that we're utilizing the infrastructure that we have in Edmonton. But the primary goal is, of course, to keep the public's health safe and protected, and I believe that we will be able to do that.
Operator, could you put through the next question, please?
Our next question comes from Kevin Minnick of Bloomberg. Your line is open.
It's actually CTV Calgary, but that's all right. Dr. Hinshaw, you spoke about the emerging science on the necessity of masks in schools. At this point, the Minister of Education says she won't make mask wearing mandatory based off your advice. But simply as a precaution, why not force students and teachers to wear masks in schools? What's the risk?
We're looking at the evidence from around the world, both the published evidence summaries, as well as the case reports from individual jurisdictions. And with respect to the risk, I think what's really important as we review the evidence is that we understand what lessons we can learn from jurisdictions where it has been made mandatory. We know that, for example, young children may feel that wearing a mask is uncomfortable, and they may be likely to touch their face or fiddle with their mask if they have something on during the day. I don't know that we have enough evidence yet to understand how young children will potentially react to wearing masks. And we know that touching one's face, especially with unwashed hands, is a significant risk factor for picking up the virus if there is someone who's infectious in that environment. So those are the kinds of things we're trying to get a better understanding of. It's really important that we try to think about all angles and potential consequences. But as I said, we are looking carefully at mask wearing, and the guidance that was referenced on Tuesday was guidance that was released a month or so ago when the first school announcement was made, and that guidance is continually being updated with new information and evidence as it's available. And as I said, we are looking at the evidence on masking at this time to try to understand what current evidence is telling us.
Operator, could you put through the next one, please?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. You mentioned the other day that half of currently active cases have an unknown source and there are likely more unknown associated cases. How much higher could the actual number of cases be then in our province? How much are we underestimating the situation right now? And also, BC tightened some rules around bars and nightclubs the other day as cases in that province increased. And you said before the hope is to not bring back restrictions, but generally speaking, with cases on the rise, how close are we to rules becoming stricter again?
With respect to your first question, it would be difficult to speculate on the undiagnosed case burden. As has been mentioned before, there are several serology studies underway in the province, and we're looking forward to seeing that information when it comes out, because that information will help us get a sense of what that proportion of the population who may have been infected and not known it or not diagnosed. So that's something that will help us get a better understanding of that. But without that, it's difficult to make a guess. With respect to the bars and restaurants, it's interesting, the media reports of the BC guidance that I've read with respect to the increasing restrictions include things like limiting the number of people at a table to 6 and not allowing people to walk up to bars to order drinks. Those are actually things that we currently have in our guidance. So as I said earlier, I think what we need to do right now is make sure that people understand the guidance is not a list of suggestions that can be disregarded if they're inconvenient, and to try to make sure that everyone across the province, whether it's patrons or owners of businesses or those responsible for activities where the public can attend, understand the importance of the guidance. And that's what we'll be focusing on, because, again, I think what BC has just introduced are the rules that we have had in place for some time.
All right, operator, could you put through the next one, please?
Our next question comes from Alana Smith of Post Media. Your line is open.
Hey, Dr. Hinshaw. I'm just wondering, what is the testing demand like in Calgary compared to other cities? And I also wanted to know if we can keep up with the demand for testing as cases rise significantly. Thank you.
I've heard reports of increased demand in Calgary, particularly for those who don't have symptoms but are wanting to be tested. I don't currently have the metrics from Alberta Health Services on the volume of requests per day or what their wait times are. What we are doing is making sure that whatever the volume of requests is, that we're reserving spots for those who have symptoms, those who are in long-term care or continuing care settings, or those who are close contacts of a confirmed case or in an outbreak setting, because it's those individuals where we would have a higher concern of potential positivity. They have a higher, what we call pre-test probability, or a higher likelihood that they could have COVID. And so those groups of individuals are the ones who we need to make sure we move through the system as quickly as possible. Unfortunately, that means that sometimes those who have no symptoms and no known exposure, it can take a little longer for them to reserve an appointment. And we are working very closely with Alberta Health Services on expanding access and making sure that we do have the capacity to meet demand. And that is a work that's in progress right now.
All right, there are 2 more in the queue. Operator, could you put through the second last question, please?
Next question comes from Michael King of Global News. Your line is open.
Hi there, Dr. Hinshaw. I know that you spoke about masks in the schools and that there's concern for the younger grades having trouble wearing the masks. Why not recommend having kids past grade 6 or grade 7 and make it mandatory there?
Again, what we're looking at is the evidence and trying to understand what the best way forward could be. Again, masking in schools is specifically something we're assessing right now and determining what that's going to look like in the next version of our public health guidance. And so these are questions that we are considering, but again, final determination has not yet been made.
All right, operator, could you put through the final question, please?
The final question comes from Shannon Scott of CTV. Your line is open.
Oh, hi, it's CBC, Shannon Scott. Hi, Dr. Hinshaw. A lot of your colleagues in the medical community here are continuing to call for mandatory masking. What do you say to them, and what is the downside? What is the danger if we were to make masks mandatory?
I think we've seen some challenges in places where masking has been mandatory, and we're again wanting to learn from those situations. We also know that while, as I mentioned, there are cases across the province, There are certain locations that do have higher risk than others. And so before we would implement a province-wide measure, I think we'd need to consider, again, whether that same measure is required across the province. Also, I think a concern that's been expressed to me, and one that I share, is that we could inadvertently, if we are focusing too much on the question of masking, we could distract from all of the other measures that are critically important. And there is some evidence to suggest that, for example, consistent physical distancing, when that's achieved, is more effective than masking. And so we just need to make sure that we're, again, assessing the evidence, understanding that risk of harm, looking at the provincial picture versus the local picture, and if there are local settings where it makes sense based on epidemiology, then the local jurisdictions do have the tools to be able to move forward with this as an addition to their particular protocols. So again, those are the things that we need to take into account as we're looking at the questions around masking.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe weekend.